welcome to the county fair, and what I'd like to do right now is present Chris and Chris from Life EMS Services. As a requirement of harness racing on our grounds, we must have a standby ambulance present for those races, and Life EMS was generous with us this year in providing coverage for 3 events here on the grounds. We have 2 days of harness racing, and then we have our tractor pull on Friday night.
My name's Chris, and this is Chris. I'm a paramedic with Life EMS, also a field supervisor. Chris is our EMT. So right here, pretty much our main stay is when a patient comes up in here, they're gonna sit on the stretcher. With the stretcher, we have just like the rules in that for riding a vehicle. Everybody has to be secured in. Right on my side here is our jump bag. We take that in and out of the house or any type of scene. Pretty much has anything that you can imagine in here, from bandages to BVMs to other medical supplies and that. Anything that you need kind of as a first in basis, besides our cardiac monitor, along with our IV supplies that's in the top kit. We have our cardiac monitor. Our cardiac monitor allows us to do a quick infield diagnosis and that, and or kind of assess the patient by doing a live EKG feed. That we put stickers right around the patient's heart. It can give us an area where exactly there's a troublesome area on the patient's heart. Allows us to continue that transport and then take them to where they need to go, along with a certain specified treatment. Above here is the airway compartment. Airway compartment, pretty much anything to manage a patient's airway, from simple non-rebreathers to nasal cannulas to a little bit more advanced on the intubation and whatnot of a patient. Sliding on over this way, we have this is kind of the drug compartment along with suction. We do have, due to COVID in that, we have gowns, masks, everything else is up in here. Down in this lower end is where actually the drug cabinet is, along with our narcotics and easy IO gun. Going back to this back cabinet is our infection control and trauma dressings, and that are all right here, easy access. And then of course we have just basic linen for wintertime, keeping warm, sheets, blankets, pillowcases, that type of deal.
Along the outside of our ambulance, we have in here a stair chair that allows us to get the patient out of an upstairs of a house when we have difficulties with that. We also have splint kits here, as well as what's called a KED kit, which immobilizes somebody while they're potentially trapped inside a vehicle. I'll close this door for you. In here we have some general markers to keep scenes safe. We also have other scene safety items in this drawer here. Other scene safety items along this side, we have our officer life vests and some mega movers here. We carry oxygen up here. We carry a large tank that we have for our patients, so if their O2 stats are low, we can provide oxygen for them, and so on and so forth. In the front of the cab is where all the controls are for lights, sirens, pressure, ventilation, all those things to keep us safe and to allow people to know that we're coming, sirens and horns and so forth. Oceana, Life EMS joined Northern Operations 2 years ago, this October. Joined the counties of Mason, Lake, Oceana, and Newaygo to become Northern Operations. In that, we work collaboratively in all 4 counties to provide coverage at all times, 365 days a year, 24/7. So if, for instance, Mason County is busy, we can shift trucks up there, or if Newaygo is busy, we can shift trucks over there, and vice versa.
Right now we have two trucks that are in Hart that are stationed there 24/7, and then 1 truck that's in Shelby. From the time of 7 o'clock in the morning till 10 o'clock at night, if a call comes out in Shelby and that Shelby truck goes out and there's 2 trucks in Hart, one of those Hart trucks will go down and facilitate coverage that way. If we get 2 calls going in the county and there's only 1 ambulance that's left, we will have a truck that will go down at Baseline and Oceana Drive, and hence some people may see out in the community when they're driving around that there'll be a truck just randomly sitting in Peterson's semi-truck parking area, and that's just to centrally locate that ambulance to respond pretty much real easy, north and south, east and west, geographically right in that area.
Summer times are obviously very busy for all of us as counties, so it takes a lot of maneuvering, and we have a dispatch based in Grand Rapids that we work with collaboratively to make sure there's coverage all the time.